Excellencies, ambassadors and representatives of diplomatic missions, representatives of governments, of the civil society, of the private sector, of international development organizations. It is indeed with great honor that I welcome you this morning to the UNDP hosted session titled Scaling Up South-South Cooperation in Poverty Reduction, Responding to Ebola as a Development Crisis. We would like to thank the organizers, the United Nations Office of South-South Cooperation and the Organization of the American States for giving us the opportunity to present to you our vision in relation to a topic that is of a global interest, poverty eradication. We chose the nexus poverty and poverty-borne disease, as we believe this is one of the most challenging issues facing governments, facing the international development community, facing ultimately all of us. 36 years ago, the United Nations established the South-South Cooperation Office with a vision to encourage growth in the Global South through trade and collaboration. Over the last 2 decades, the South-South Cooperation has led to rapid growth in most of the countries of the Global South. However, we consider that the mission is not yet accomplished. And as we all heard yesterday, there will be no positive outcome in the coming 15 years unless cooperation, intergovernmental partnerships will be scaled up. It is with great honor that I'll chair today a panel of distinguished representatives of countries that have come together in support of a development response in West Africa. And I am privileged to give the floor for the opening remarks to Ms. Ruby Sandu Rojon, Deputy Director of the Regional Bureau for Africa in the United Nations Development Programme, a distinguished colleague of us, a champion who visited countries in West Africa, and a person who has had a long career in the United Nations as resident coordinator in Ghana, as country director in Burkina Faso, as chief of Africa section in the United Nations Volunteers organization, as well as deputy country director in Madagascar and special assistant to the UNDP administrator. Ruby, the floor is yours.
Thank you very much, Simona, for that introduction. And let me just start off by saying that first I'd like to thank the organizers for having me as a part of this discussion today, this morning, because I think it's key in terms of looking at South-South cooperation, in terms of looking at how we can have South-South cooperation really promoting sustainable economic growth, and particularly the session today. You know, I had the opportunity to visit the 3 countries in early October to be able to assess the situation and to really meet with the different partners. We met with the UN families and UN system in the 3 countries. We met with the presidents, we met with the national coordinating commissions, we met with the NGOs, we met with civil society organizations, volunteers, and that gave us an opportunity to see what the situation is, as well as what is it that needs to be done in terms of responding to this crisis. And you know, I came away with a sense of urgency, but I also came away with a sense of recognition of the commitment and the engagement of the people who are fighting against this virus. So in terms of my welcome remarks, what I'd like to do is to actually share just 2 points in particular with you. One is on the impact of the Ebola crisis in the 3 countries, and the second is in terms of how the importance of this South-South collaboration and what is going on with all of you here during this week, as well as work that has been undertaken through the Global South and the triangular initiatives, how that really is key in terms of responding to this crisis. We know that the crisis destroys lives, it decimates communities, it destroys countries. But what we have to understand is that the crisis that's caused by Ebola must not lead to an economic collapse. You know, while the death and the suffering that's caused by Ebola is immediate, and that we have to do everything that we can to stop it, but what we have to understand is that the socioeconomic impacts of this disease will probably last a lot longer after Ebola has been brought under control. And this epidemic, what's key about it is that it's actually affecting the ways and means that the poorest communities in the most vulnerable countries had in terms of making a living. So we have to see what it is that we have to do to address this. And as an extension of this crisis, the different travel bans that have been imposed are fueling stigmatization, and they're bringing about further and unnecessary social and economic hardship. You know, you also have to understand the context of the countries in which this crisis occurred. And the three countries, Sierra Leone, Liberia, Guinea, were just coming out of protracted crisis, and they had started developing and consolidating their development gains as well as consolidating their different institutions. But the Ebola crisis risks reversing those peace dividends and development gains in these countries just recently emerging from the crisis, and where they were starting to make some progress on human development. If you look at the economic growth indicators for the three countries in 2013, for Guinea and Liberia, you're talking of growth at about 5%. In Sierra Leone, it was about 11%. But when we look at the growth indicators now, with Ebola, you're looking at a decrease of more than probably 3.5%. And for these countries which have just emerged from years of conflict, they have weak institutions. They still have very fragile societies which are trying to build social cohesion. And you're putting at risk, in effect, all of these different efforts that had taken place on reconciliation. And what we have to understand is, while we can talk in terms of numbers, because we're always talking in terms of the numbers of the cases, the numbers of the death, and you're talking in terms of the economic growth numbers, etc., what you also have to look at is what is the impact that this is having on people's lives. And the Ebola impact, the crisis actually is having a very long-lasting impact on the livelihoods and economic growth in the affected countries, especially in rural areas, and especially also due to cross-border. Ebola doesn't know the border. I mean, when you look at how communities live in the three countries, it's families that are actually living on other sides of the border, so you cannot stop it in terms of just having border controls. It's something that goes beyond, because it's families, they're interconnected. And what you are seeing is that in many of these countries which were coming out of crisis, they had put aside their funds to be able to invest in infrastructure. Well, all of that has now changed. The funding and the manpower, excuse me, which was meant for development work, is now being diverted to tackle this crisis. The government's budgets are also being restrained because the funds are being used to be able to respond to the crisis. At the same time, because in many of these countries, private sector, the mining industries, the palm oil plantations have reduced their work or have actually moved out of the countries, which means that revenues coming into the country's budgets have also declined. Ports have closed, borders have closed. So in terms of export, that has also had an effect on the economies, which means that the governments are now struggling in terms of even establishing their fiscal space. But at the same time, beyond the economic effects and beyond the health impact that it's having, the crisis is eroding trust among the communities. It's stigmatizing the victims and the survivors, and it's destroying the confidence that people had in health systems as well as in the different government services, which is very key, especially in countries that are coming out of crisis. You've got traders who are no longer going to markets. You've got health workers who've been attacked in some of the locations. And you have health services as well as other services. I mean, education, for example, is completely stalled. There is no schooling going on in any of the three countries. The epidemic is isolating millions of vulnerable people, among them women, men, children. And it's also shattering their prospects for a future life. I mean, to give you an example, when we were in Guinea, one of the areas, Haute Guinea, this region has not been affected by any Ebola case. But at the same time, it's the region that produces the fruits and vegetables which are actually exported to all of the surrounding countries. Well, because the borders have been closed off, more than 50% of the fruits and vegetables are sitting there rotting. And who are the producers in this area? It's the women. If you compare the export of produce such as potatoes in 2013 and 2014, 90% decrease in the export of those potatoes. So you've got actually the impact of the crisis going beyond just the health. It's affecting livelihoods, it's affecting markets, it's affecting people's lives. And as we said, that women are also the most seriously affected by the crisis because they make up a disproportionate percentage of the health workers. They are the first caregivers in the families and in the communities. And also when you look at the health services, they are also involved not only as nurses and doctors, but they're also the ones who are probably handling the cleaning services and the laundry services in many of these in the public health sector. Food security. This is another area as well that we have to keep in mind because food products are not reaching markets. Prices are increasing, but at the same time, because there is a restriction on movements, farmers are no longer going to produce, nor are they going to harvest, nor are they going to plant for the next season, which means that come January, we're going to start seeing some serious incidences of food insecurity in these three countries. That's just to give you an idea of the impacts of the virus. Now to talk a little bit about what the international community is doing. And here I think we have to recognize what the UN mission through UNMIR has established as its goals, the 5 goals, and this is where we all have to work together. We have to stop the outbreak. We have to treat the infected. We have to provide the essential services. We have to preserve stability. And we have to prevent outbreaks in other non-affected countries. And I think we have to recognize, and this is where I'd really like to recognize many of the different partners who we've got here who have actually provided the support. The international community's response has been tremendous, especially from the Global South. If we look at the African Union is actually deploying medical staff to the different countries. ECOWAS countries have been working to plan also similar initiatives, but at the same time, they're also working with their member states to ensure that they keep their borders open. I also want to commend countries such as Senegal and Ghana, which have actually established humanitarian corridors in order to ensure access of people coming in and out of the countries. Nigeria, it's a success story. They've been able to deal with the outbreak, and I think it's a country from which we can learn in and see how we can use their lessons in other countries. Uganda, which has had its own outbreaks, has sent personnel to support in clinical management, coordination, surveillance, and laboratories. The Gambia was one of the first countries that had put funding to finance the African Union's Ebola Fund. But those are not only countries, but we also have to recognize private sector and foundations in the region, which have also played an important role. The African Philanthropic Society, the United Bank of Africa. So I think we really do need to recognize them. At the same time, the Global South, the way that you're all coming together is tremendous, and I think it needs to continue. I had the opportunity to meet with both the Chinese as well as the Cuban delegations in the different countries while they were there. China, with its experience in SARS, has actually sent more than 170 medical workers. Cuba is deploying more than 200 health workers to the different countries. Russia has deployed medical teams, and they're on the ground working also in laboratory testing. I really want to be able to say that, visiting the 3 countries, you go away with a sense of urgency, with a sense of desperation, but at the same time, meeting with some of the different health workers who have come from these different countries, you recognize the dedication, the passion, and the engagement that all of them have in trying to contain this virus. And I think that that's key, because it shows that this South-South global cooperation actually is key to not only be able to respond to the virus today. So what you're really doing is helping to isolate the virus, but not isolate the country. So I think that's very key for us. At the same time, what is it that we are doing in UNDP? In UNDP, we're doing three things. First, we're supporting the coordination and the delivery of essential health services. Second, we're also working in community engagement, social mobilization. And third, we're working on the longer-term response, looking at the economic impacts as well as planning already for early recovery. What I'd like to say in ending is I want to share with you an example of how working together through a South-South alliance that can really help, but also the triangular initiatives. You know, UNDP, through its Global Environmental Facility, is working with the government of South Africa to make available the deployment of an eco-friendly sterilizing machine. Now, this machine is called an autoclave. An autoclave, it's the size of a refrigerator, basically, and what it does is it decontaminates and it compresses medical waste, which means the PPE equipment that's used in the different countries to protect the people can be used to be decompressed and decontaminated and compressed in these autoclaves. And they are an alternative, an environmentally friendly alternative to what's already happening now, which is burning in open pits, in barrels, which is also actually quite dangerous because the fumes can also expose medical staff as well as the surrounding communities. And we've been able to organize this with the government of South Africa to be able to send these autoclaves and make them available to the different treatment centers. So I wanted to leave you with that example as to how you're all making it possible through this South-South collaboration. Thank you very much.
Thank you, Ruby, very much. Thank you for setting the stage for a discussion in which we will have most of the champions that have provided support to countries affected in West Africa. Our champions today include the Gambia, Cuba, Nigeria, China, as well as Uganda and Russia. And we will start by saying that the principles of the South-South cooperation have mobilized those countries in full respect of sovereignty and of all national values and in solidarity to respond to a crisis that goes beyond health issues, beyond the health impact and quality of life impact across those countries to a development crisis, to which we are hoping that together we will be able to provide a response once the crisis is being contained. So it is with great honor that I invite His Excellency Omar Sey, representing the Gambia, currently Minister of Health and Social Welfare in the Gambia, a country that has provided, that was the first to provide a contribution to the Africa Union Ebola Fund, and also to disburse 1 million in support of Sierra Leone and Guinea, while launching an Ebola virus disease preparedness response in the country. His Excellency Mr. Omar Sey is, as mentioned, currently Minister of Health and Social Welfare. He was the Chief Executive Officer of the General Hospital in Gambia, and from 2011 to 2012, Mr. Omar Sey was the hospital manager at the Aga Khan Health Services in Afghanistan. Your Excellency, the floor is yours.
Thank you very much. I bring you greetings from the President and people of the Republic of the Gambia, the smiling coast of Africa. The government of the Gambia is very happy to be associated with this development and is highly represented by a permanent secretary from the Office of the President and a permanent secretary from the Minister of Finance and Economic Affairs, and well, efficiently and effectively coordinated by our own UNDP resident coordinator, Mama Ade. It is a great pleasure for me to address this important session on poverty eradication, that is responding to Ebola as a development crisis. Your Excellencies, ladies and gentlemen, allow me to briefly highlight the gains made in fighting this menace called poverty over the years, with particular emphasis on sub-Saharan Africa. As indicated in a UNDP report, Sub-Saharan Africa achieved sustained levels of economic growth over the past 10 years. Sub-Saharan Africa has continued to grow steadily in the midst of a prolonged international financial and economic crisis. The region has experienced considerable structural change, with increased domestic demand for basic consumer goods, a growing middle class, and a rapid urbanization, coupled with improved macroeconomic foundations, better policy making, and strong engagement with emerging economies such as Brazil, China, and India. This is testament to the very essence of the South-South cooperation, as Brazil, China, and India are important players in the South-South cooperation. Consequently, the region has had the highest growth in the Human Development Index after Southeast Asia in the past 10 years. Both statistics are endearing as we continue to improve the livelihoods of our people. Of the 14 countries in the world that recorded ADI gains more than 2 percentage points annually since 2000, 11 are in sub-Saharan Africa. To put that into perspective, this consists of countries with high-performing agricultural-based economies, not just those endowed with natural resources. Noticeably, progress has also been registered towards the attainment of the MDGs, with considerable improvements, for instance, in primary education, gender parity, and the fight against HIV and AIDS. However, the sustainability of these gains are at stake in the face of the recent Ebola viral disease epidemic, which has struck Guinea, Sierra Leone, Liberia, Nigeria, Senegal, and now Mali. This epidemic threatens the sustainability of the gains that have been registered and seriously undermines current and future efforts geared towards reducing poverty. The Ebola viral disease is not only devastating in loss of lives, but it has threatened to ravage our economies. Efforts to control the epidemic have led to restrictions on trade and travel. These restrictions are already having negative economic impact, which also linger in the short and medium term. The EVD epidemic is a challenge to our development aspirations. To contain the epidemic and robustly address the challenges that it poses, we need an integrated response to the crisis, which focus on further enhancing access to services and medicine. Access to services and medicine is an integral part of our current national poverty reduction and development strategy, which is called the PAGE. That's the Program for Accelerated Growth and Employment. Your Excellencies, ladies and gentlemen, before talking about the response mechanism, it will be apt to briefly highlight how this epidemic threatens our development efforts and inflict damage on our economies. The World Bank estimates that GDP will drop in the affected countries that are in Guinea, Sierra Leone, and Liberia by 2.1%, 3.3%, and 3.4% respectively. This is an estimated loss of 359 million in 2013 prices. The short-term fiscal impacts are also light, at 113 million, that is 5.1% of GDP for Liberia, 95 million, 2.1% of GDP for Sierra Leone, and 120 million, which is 1.8 GDP for Guinea. These estimates are best viewed as lower bounds. Over the medium term, however, both epidemiological and economic contagion in the broader sub-region of West Africa is unlikely. Using the best case scenario, called low Ebola, the loss in GDP for the sub-region is estimated to be 2.2 billion in 2014 and 1.6 billion in 2015. On the high Ebola, the estimates are 7.4 billion in 2014 and to 25.2 billion in 2015. That is in the low and the high case scenario. These points, coupled with the unbearable pressure on our healthcare systems, necessitate an integrated response if we are to make headway in stopping the disease. We recognize the efforts by governments of the affected countries and help from the international community. And here we have to commend the UNDP. Having said that, we cannot rest on our laurels, for complacency could exacerbate this crisis. Talking about complacency, the Gambia has not yet registered a case, but we have already laid down the pillars for the integrated approach to prevent the spread of the disease in the country. The geographic proximity of the Gambia to the epidemic foci in Guinea, Liberia, and Sierra Leone, together with close social cultural ties and the extensive population movement across porous borders, puts the Gambia at a particular high risk of importance of the Ebola virus. Further, the current outbreak of Ebola in these countries, with the likelihood of spreading within the West Africa region and beyond, has made it imperative that a robust and a sustainable surveillance system be put in place in the Gambia, with emphasis on early detection of any imported case of Ebola viral disease and on prompt action to prevent its spread. We take inspiration from Senegal and Nigeria in halting the transmission of the Ebola virus. The good and success practices in these countries could be shared within South-South cooperation. It highlights the critical importance of preparedness in countries at high risk of an outbreak. We believe the following measures are best for countries considered by World Health Organization as not affected like the Gambia and forms our strategic goals of our national plan. 1, develop, implement, and access preparedness measures. Active surveillance for clusters of unexplained deaths or febrile illnesses. Prompt identification of suspected and probable case to laboratory diagnosis and effective case management. Accurate general, public, and relevant information on Ebola viral disease outbreak and measures to reduce the risk of exposure and effective social mobilization. Protocol for managing travelers arriving at major landing crossing points with unexplained febrile fever illnesses. Identification and preparation of treatment centers and isolation units where any suspected or probable Ebola viral disease case can be properly investigated and managed. Process for rapidly shipping diagnostic specimens to a WHO recognized laboratory. Simulation exercise to test the performance of detection and response systems to a suspected or probable case of Ebola viral disease. Effective coordination of the preparedness and response plan. Logistics case management, that is personnel, protective equipment, body bags, dedicated ambulance, especially designed to transport and transfer suspects and patients from communities to treatment centers, medical equipment and supplies for at least 3 treatment centers started located across the country. Funding to support active surveillance and investigation of alert cases, that's in terms of telecommunication, transport logistics, data systems, etc. Infection prevention and control materials, that's bleach, hand washing, sanitizers, alcohol-based hand drops, etc. Funding for training of healthcare workers in surveillance, infection prevention and control measures and case management. Establishment of biosafety level 4, cabinet containment laboratory capabilities within the national reference laboratories. These are all key and very, very important. You will observe all these are geared towards enhancing access to services and medicine for all and sundry. Critical if we are to have any chance against this disease. This takes me to the next and perhaps the most important point. How do we ensure, in the spirit of South-South cooperation, that all member countries have at least a functioning national plan, especially for countries at high risk? This roadmap in terms of national action plan and how such programs can be financed should be one of the main outputs of this important summit, I believe. In summary, we need the following basic information regarding state of preparedness. Do we all have a national plan of combating this epidemic? As it should be an integrated approach, all sectors in a country must be included. In particular, youth groups and the civil society organizations for the sensitization and aspect. The South-South cooperation could render help to actions without a comprehensive plan. Each country to access funding gaps for the full implementation of the national plan. This is in cognizance of the fact that most high-risk countries are still low-income countries or at best middle income. Therefore, the support of this forum will be highly needed and appreciated. As the clip goes, it pays off to put out the fire in your neighbor's house. Following from that, in the spirit of South-South cooperation for development, we in the Gambia have rendered help to affected countries. This involves monetary and material support to the governments of Sierra Leone and Guinea-Conakry. We believe our approach could be a best practice for member countries in the South-South cooperation. I thank you for your kind attention.
Your Excellency, on behalf of UNDP, I thank you very much for your commitment and for your prospective view with respect to our continuous cooperation on building resilience, national capacities and resilience, so those countries can face crisis and natural disasters without such a setback in terms of their development indicators, such a drop in Human Development Index, such a broad impact on multidimensional poverty. With many thanks to the Gambia, we move forward to our next champion, to Ambassador José Ramón Cabañas Rodriguez, representing Cuba. Cuba, a country that has played an important role in contributing to mitigating major disasters, supporting relief brigades in Pakistan after the earthquake in 2005, and then providing a similar support to Haiti in 2010, and being today the first foreign country to deploy a medical team in Ebola-affected countries in West Africa. Ambassador José Ramón Cabañas Rodriguez has been also specialist assistant at the Cuban Ministry of Foreign Affairs, and then secretary at the Cuban Embassy to Ottawa, deputy director of the North American Affairs Division at the Ministry of Foreign Affairs, and he also headed the Division of Cuban Residents Abroad earlier in his life. Today, Mr. José Ramón Cabañas Rodriguez is the Chief of Mission of the Cuban Interest Section of the Embassy of Switzerland in Washington, D.C. With many thanks, Ambassador, the floor is yours.
Good morning. Thank you, Mrs. Marinescu and Mrs. Sanhu, for your kind words towards our country. Dear Minister, Excellencies, a member of the panel, ladies and gentlemen, the terrible Ebola epidemic that continues to spread in some countries in Africa is an enormous challenge for all of us. To address this threat, we need the commitment and effort of all nations, each according to its abilities, coordinated by the United Nations at the leading role of the World Health Organization, UNDP, and other organizations, to ensure a collective, coordinated, and effective action. Based on modest experience on the Cuban health system, desire for integration, organization, planning, and coordination of care, and not just curative but preventive work, is needed. This requires, as an essential complement, systematic and ongoing work great discipline and compliance with medical protocols, rigor, and requirements. And we have to say that respect for protocols could mean the difference between life and death. It is necessary to react against Ebola, but equally necessary is to allocate a sustained and predictable human, material, and financial resources for Africa's development. Cuba, who feels bound to the fate of Africa's indelible ties, has faced this predicament in the spirit of solidarity that characterized its relation with the continent in the past 55 years, in which more than 76,000 Cubans collaborated, have provided services in 39 countries. So, to help the 3 countries most affected by the outbreak of Ebola, Sierra Leone, Liberia, and Guinea, we sent 3 specialized medical brigades composed of 256 professional international contingent members of the doctors specialized in disaster and epidemics, a contingent called Henry Reeve, after the name of an American hero who fought in the Cuban War. In addition, the 4,000 Cuban health, as part of our international collaboration program, are working in 32 countries on the continent, have been incorporated, all of them, into preventive work against Ebola, with the aim of developing a program training on the prevention, diagnosis, and treatment of the disease, which means that on plus of what we have on the ground, we have 4,000 others who can be trained and can work with many countries. To do this, facilitators within our associates who will train the rest of the Cuban staff and Cuban residents in these countries were identified. This training program can be extended to national professionals in these countries if requested by the respective governments, which means that all of us, we have a lot of potential if we can act together. However, combating this outbreak is not limited to its control in Africa, but also includes the prevention of its spread to other countries. Therefore, we welcome the initiative of the President of the Bolivarian Republic of Venezuela, Nicolas Maduro, and held in Cuba an extraordinary ALBA summit on Ebola, with the objective of concluding the joint action of the major integration bloc. This event, which was held in Havana on October the 20th, served as a starting point for regional coordination of efforts in preventing and coping with the epidemic. And I have to say that an action plan was approved during the meeting with 23 measures. The action plan is available for everyone. In that context, was convened in Havana on October the 29th and the 30th, a technical meeting of experts and managers to preventing and fighting the Ebola virus, which was attended by 278 specialists and executives, 110 from other nationalities, and 168 Cuban and Americans representing 34 countries. In this workshop, issues related to clinical management, epidemiology, training of human resources, and social communications were addressed. As a complement, on November the 10th, started in Cuba at the Institute of Tropical Medicine, Pedro Curie, an international course of prevention and response to the epidemic of Ebola, attended by 100 specialists and technicians in the region of the Americas. On the other hand, at the regional level, recently, we communicated to the governments of the 25 nations of Latin America and the Caribbean, where we have serving 45,952 members of the health system, that our staff is ready to assist in prevention efforts, training, and counseling against Ebola. Also, our country is prepared to prevent the entry and spread of this disease internally, domestically. In this regard, Cuba has implemented a national plan for prevention and engagement to the Ebola virus, to fight the Ebola virus, which has the overall objective to prevent the introduction and spread in the country and to consolidate a range of health surveillance, prevention, care, biosecurity, which, with the participation of all sectors of our society, we can have early case detection and prompt implementation of control measures. Undoubtedly, The Ebola epidemic is a global problem whose solution must converge the efforts of all nations, rich and poor, but above all, is a moral imperative. Cuba has gathered some expertise on the subject, and it is open to share it with all nations and international organizations. Thank you very much.
Much gratitude, Ambassador Rodriguez, and we would like to also express our hopes that the cooperation will continue beyond the crisis, again, to build resilience in those countries. I would like to invite our next champion today, who represents Nigeria, a country that has contained the Ebola spread in its early stage of development, and a country that has provided support to countries affected in West Africa, training over 590 health workers, and also providing a financial contribution to the ECOWAS fund of $3.5 million US. So I'm inviting Dr. Cyprian Tessir Hin, who is currently Minister Counselor at the Permanent Mission of Nigeria, and who prior to that was Special Assistant for the Office of the Chief of Staff of the President of Nigeria, Senior Counselor for the UN Specialized Agencies in Abuja. Your Excellency, the floor is yours.
Thank you very much, Simona. Thank you, Ruby, for anchoring this occasion so perfectly well. I bring you greetings from the Permanent Representative of Nigeria to the United Nations, Professor Joy Ugu, who would personally have loved to be here, but is unavoidably absent due to other pressing issues. And she asked me to say this on her behalf. I commend the initiative of the United Nations Development Programme for convening this very important event, which provides the platform to discuss Ebola virus disease and to share experiences and ideas on ways of combating the deadly virus. I'm honored and delighted to discuss Nigeria's achievement in tackling Ebola virus disease. It is our hope that the lessons derived from Nigeria's success in combating what many believed had the potential of being the most explosive Ebola outbreak ever would serve the efforts in the countries deeply troubled by the virus. The first confirmed case of Ebola in Nigeria was recorded on 22nd July 2014. The victim, a Liberia, died 3 days later. Subsequently, there was a total of 19 cases. 12 of the victims these 19 cases were actually linked with the index case of the Liberia. 12 of the victims were treated successfully. Unfortunately, 7 of them were lost. The strategy adopted by Nigeria in containing Ebola was a simple but pragmatic approach, driven by strong partnership, clear leadership, and an inclusive and multi-layered governance structure. The measures taken include the creation of dedicated establishments, as well as instituting policies to contain the spread of the virus and to attenuate panic over the disease. Measures taken are categorized into 2 groups. Some of them were enlightenment measures. The others were actions that the government took in order to contain and control the disease. Under enlightenment, we basically took some measures to ensure that there was no misinformation and avoid fears that could arise from those misinformation. And these are the measures we took. The government set up a presidential interministerial committee on communication strategy for Ebola virus disease prevention and containment. The establishment was headed by the Minister of Information and mandated to prevent false and erroneous information on EVD. Second, dissemination of information on EVD was further intensified through television, radio jingles, bulk SMS text messages, hotlines, dedicated toll-free lines, and distribution of leaflets. In addition, regular briefings were held to provide Nigerians with updated information on the outbreak. Mortuaries across the country were instructed to undertake necessary health safety measures regarding receiving corpses from outside the country, especially from countries where Ebola outbreak had been reported. The second group of measures Nigeria took had to do with addressing the situation itself, the outbreak. And these are the measures. Upon confirmation of a suspected case of EVD, the Health Ministry instantaneously dispatched a rapid response team headed by the Director of the National Center for Disease Control to contain and control the outbreak. In addition to the NCDC, which coordinated all fees operations, an Ebola Emergency Operations Center was created to coordinate day-to-day activities on matters relating to the virus. Body scanners were provided at all ports of entry/exit, manned by Immigration and National Center for Disease Control officials, who were required to undertake on the new measures in place regarding e-travelers reported at ports of entry and exits. All travelers were then and are now required to undergo Ebola screening measures, which include questionnaires employed to determine potential risk. If a traveler is discovered to have developed a fever or has been exposed to Ebola, the individual will be subjected to further investigations. The commitment of all Nigerians in applying these simple measures were largely responsible for the success achieved in containing the spread of Ebola virus disease. And let me say this quickly. When I was talking about the information dissemination and the importance, the criticality of information with regard to Ebola, people need to actually know everything about the disease. If that is not done, it generates undue and unnecessary panic, and in the process, they engage in doing things they should otherwise not do. Let me give you an example of what happened in Nigeria at the early outbreak of the disease. A few days when there was rumor that the disease was spreading, and given that in other countries that it had been affected, it was spreading at exponential rate, Nigerians became panicky. And before you could know what was happening, there were text messages all over admonishing people to use salt, S-A-L-T, put inside their water, bath with it, and also drink. And they told them that that way they would be immune from Ebola virus. And people unknowingly went into this. Some drank salty water, and those that had high blood pressure problems went into crisis. and died in the process. So we saw information dissemination on Ebola as very critical, and so that was very, very well addressed. And it was able to attenuate panic and dissuade people from engaging in undue actions. The commitment of all Nigerians in applying these measures have largely been responsible for success achieved in containing the spread of Ebola in Nigeria. We received the declaration of Nigeria as Ebola-free by World Health Organization on 20th October 2014 with great delight. The critical lessons to be learned from Nigeria's experience is the need to ensure exhaustive information dissemination in order to create awareness of the fatality of the virus, prevent measures to be taken to avoid its spread, to preclude misguided information and panic among citizenry. Second is that broad synergy between the component units of government is essential for achieving success in tackling EVD, particularly when a component unit possesses competent leadership and experience to effectively deliver on the issues at stake. Nigeria cannot be said to be complete Ebola-free by stopping the spread of the virus within her territory, while her neighbors are faced with the epidemic. It is in this recognition that Nigeria has delineated a comprehensive program to assist countries combating Ebola virus. Nigeria has trained 591 health practitioners who have volunteered to join the international force going to Guinea, Liberia, and Sierra Leone to assist in the containment of the Ebola virus disease. In addition, Nigeria has pledged to offer specialized training to health personnel combating the EVD in the affected West African countries. So far, Nigeria has donated the sum of 3.5 million as part of her intervention in the affected countries, of which each country has received funding in the amount of $500,000 US, while the sum of 2 million was donated to the Economic Community of West African States, ECOWAS Common Fund. Drugs amounting to 50 million naira, equivalent of $292,483.18 are also to be donated to Sierra Leone. Aside from national efforts, pledges have been received from Nigerian foundations to assist the affected countries in containing Ebola virus. I cannot conclude without commiserating with the families of the victims of Ebola virus and expressing our best wishes to the people and success in the efforts being undertaken to combat the virus in the affected countries. Thank you.
Thank you, Dr. Hin. Remarkable prevention action plan. Indeed, information and relevant information unleashes individual capacities of people to protect themselves and reduces massive public spending. We very much hope that countries in the region will get to learn more from the successful example of Nigeria in preventing the disease. Our next champion has come a long way to be today with us and to celebrate the spirit of solidarity of the South-South cooperation. Mr. Yan Shenhong, who is currently Director General at China International Center for Economic and Technical Exchanges, has come to share with us the incredible experience that the country has gained through its own spread of severe acute respiratory syndrome, SARS, in 2003, and to share with us the ways in which China, again, a faraway country from West Africa has contributed to the response, to the crisis response and to the development response that UNDP is leading on. China provided assistance to national health systems in countries affected through training and sharing of Chinese experience, and the objective is to train 10,000 health professionals in Sierra Leone. In addition to that, a contribution of $126 million was made to include support through medical workers, supplies, and construction of treatment centers. And in addition to that, another $6 million was disbursed to the UN Multi-Partner Trust Fund in response to the crisis and in preparing a development response as well. So we would like to thank you, Mr. Shen Hong, and the floor is yours.
Thank you, Madam Chair. It is a pleasure really for me to participate in today's meeting, which is a very important effort of the international community under the coordination of the UN system in combating the Ebola epidemic, showing solidarity of member states in dealing with Ebola. The Ebola epidemic has harmed health, safety, and lives of the people in the epidemic-stricken countries, severely impacting local economic development and social stability, and posing imminent threat to global public health security. Ever since this breakout in the Western African countries in March 2014, the Chinese government has been among the first to react. By October 2014, the Chinese government has provided 3 batches of diseases prevention and control materials, grains and food to the affected countries. On October the 24th, our President Xi Jinping announced that the Chinese government would deliver the 4th batch of assistance, worth of 500 million Chinese renminbi to Western African countries to help them fight the Ebola epidemic following the previous 3 batches of assistance, including materials, medical materials, food and grains, capacity building, health center construction, medical team and experts, cash assistance, and international cooperation. So far, all these measures have been implemented swiftly to help the African countries to combat Ebola and reduce life losses as much as possible. Ladies and gentlemen, since April, China has provided 4 rounds of assistance with a total amount of approximately 750 million renminbi to the affected countries. China is the first to provide aid to the affected areas and to ensure their timely delivery. Our embassy in Sierra Leone and the transportation enterprises transported the needed goods to the remote mountainous areas amid heavy rains to ensure the local people could gain access to the aid as soon as possible. Chinese government has provided prevention materials and medical experts to the affected areas. And in addition, we also dispatch doctors to inspect, observe, and treat the patients directly. By the end of October, medical experts from China have received over 200 suspected cases, with over 100 of them diagnosed of Ebola. In addition, while we have the experiences that 10 years ago in combating SARS, so we try to disseminate the experiences that we have, that we summarized as early discovery, early reporting, early diagnosis, early separation, and early treatment. So the experiences, to some extent, have helped the aid work. In addition to the emergency responses, China has also promised to carry out long-term China-Africa public health cooperation to enhance public capacities. We not only provided aid to the affected areas, but we also provide aid to the surrounding areas for prevention. In addition to the bilateral aid, China also has provided through multilateral channels cash assistance to these countries in response to the call for international cooperation. In terms of international cooperation, China has also strengthened its coordination with the international community. We have strengthened its information sharing with WHO to avoid aid duplication. We made donations to multilateral organizations, such as $2 million to African Union, $2 million to WHO, $6 million to World Food Programme, and the UN Ebola Response Multi-Partner Trust Fund with $6 million. China has participated in the UN Ebola response meetings like this one and strengthened coordination with other countries, such as UK, France, and the US. Ebola shall be dealt immediately to prevent it from further spreading. However, from the long-term perspective, it is also very important for the African countries to improve their economies and their public health capacities. Therefore, it is our opinion that the international community shall provide more development assistance to African countries to get rid of poverty and realize sustainable development in the post-2015 period, and enhance their public health capacity in the long run, which is fundamental to the fight against the Ebola and similar epidemics. To this end, in addition to the emergency responses, China has already promised to initiate the Sino-Africa Public Health Cooperation Plan and organize 12 training courses for affected countries of public health and epidemic prevention and control. We will carry out joint researches on tropical diseases with Africa and help Africa build up a public health information platform and an epidemic prevention, control, and monitoring network. We hope the international community would join hands in providing development assistance to Africa. Diseases know no borders, and true friendship is honored by hardships. Ebola is ruthless, but we, members of the international community, are determined to fight it in joint hands. So we hope that through our joint efforts, we can have a satisfactory outcome in combating Ebola. Thank you for your attention.
Thank you very much, Mr. Yao Shenhong. China will continue to be our main partner in South-South cooperation beyond the crisis, beyond the problems we are now facing in West Africa. Our next champion has also traveled to be here with us today. Dr. Barry Kisnasamy, who is Ebola Response Coordinator in the Department of Health Disease in the South African government, in the National Department of Health in South Africa, will share with us the response that they've provided to countries in West Africa in multiple ways. And if I may, Dr. Kisnasamy, I would like to also mention that you have worked with the World Health Organization as well as with the International Labour Organization and the World Bank. And you have led the response of South Africa that has consisted of deployment of a mobile laboratory that was sent to Sierra Leone, as well as further support to Liberia, where you plan to send a 40-bed field hospital. You've staffed 75 health professionals, and the government also provided support to the Southern African Development Community for the training of health and support personnel affected in vulnerable countries. Very importantly, the government of South Africa has managed to mobilize private sector as well in this response. So the private sector of South Africa through goods and services has made a contribution of $2.6 million to the response, in addition to $3.5 million provided by the South African government to the response to the crisis. Dr. Kisnasamy, the floor is yours.
Thanks, Program Director. All protocol observed. It's a privilege to represent my government and as part of the continent in terms of support to our brothers and sisters north of us and to the west. So I'm quickly going to spend some time just looking at the context of the Ebola crisis. It's been covered somewhat by the opening remarks by Ms. Ruby Sandus Rojan. But one of the issues is about being in post-conflict situation. And secondly, within Africa, we face what's called the quadruple burden of disease. So it's really related about emergent and re-emergent threats, and Ebola falls within that. It's the chronic disease issues, it's environmental and occupational health issues, and injuries. So these are the various issues facing us within the context of Ebola. And one of the issues, as pointed out by colleagues from Nigeria, was it's the first time in West Africa that we've seen Ebola. Previously, it was mainly in the DRC, isolated to villages and rural villages, and in the first time, so health professionals untrained and communities within socio-cultural traditions did not know what was going on around them. And part of it was then related to opposition politics or issues around burials and safe burials. So these were some of the things that ultimately led to the massive spread. And of course, critical to the whole issue is poverty. Now, Africa is a very well endowed, and part of the slide is when you're seeing the yellow and the blue and the kind of issues around it. Those are some of the issues that are pointing out to the massive mineral resources in the continent. And these countries of Guinea, Sierra Leone, and Liberia also have large mineral resources. So one of the early issues is many of the South African companies were quite heavily invested in the mining sector, the ICT sector and the banking sector, and also the retail sector. So at a very early stage, we began to engage with them in terms of what could they do to assist the countries, not just digging a hole in the ground, but also beginning to start looking at the human and other conditions that are facing our people now that we have the Ebola epidemic. Now, the director pointed out some of the issues around, or Ms. Ruby talked about the issues around the economic issues. Now, one of the problems that we've had is tourism. And sometimes people don't understand geography. So parts of West Africa are closer to Europe than to Southern Africa, but we've had massive cancellations of tourism and tourists coming into southern part of Africa when, you know, Ebola is just seen. So sometimes I think part of the issues we've got to do is about the education of people on geography, to say that Africa is a large continent, it is not one country. And therefore, when you have some effects in parts of the region, it does not affect the entire region. Of course, it affects us from a humanitarian and solidarity point of view, but some of these problems have faced us in terms of trying to tell people that Ebola is actually quite far from us, and the flights to Europe are actually like 5 hours away, and the flights to South Africa are 7 hours away. So these are some of the issues that affected us as we go forward in terms of South-South cooperation. Okay. Right, so the other context was, unfortunately, Ebola affected health workers. So it was one of the few diseases that took out a lot of health workers along the way. So if you're looking at currently, we've had about plus minus 600 health workers infected, and about 300 have died in a continent which barely can afford to lose its health workforce. So Africa currently has 24% of the disease burden of the world and only 3% of the health workforce. And losing health workers to a disease process when we are on the front line, myself, I'm a medical doctor, when we're on the front line of trying to manage and treat the disease process, actually was quite catastrophic as well. So our response consists of multiple fronts. One was the domestic response. Yes, there were some issues around the concerns around not a travel ban, but travel restrictions, because we had to put in some measures in terms of this is quite a diverse process of travel within the continent. So we had to put in things like screening and health screening questionnaires. But the external humanitarian response was quite massive. So we moved in quite early on in terms of diagnostic laboratory services. The Ebola virus, unfortunately, does need a diagnosis because there are other diseases like malaria, Lassa fever, Marburg virus. So there are other viral diseases that mimic the Ebola virus. So you actually do need to have diagnostic laboratories set up, and we had competencies in that. And in mid-August, we actually moved in by setting up a fully fledged mobile laboratory in Sierra Leone in Freetown. To date, it's done 3,000 diagnostic tests and been a major effect in terms of the armamentarium against the Ebola outbreak. So that laboratory continues. We move personnel in, and we're also training Sierra Leoneans in terms of the laboratory diagnosis. It does need a fairly, what's called a BSL-4, so it's a very high-level laboratory, although set up under field conditions, and we put that in. And that's fully supported by my government. We are currently, as the program director has pointed out, mobilizing goods services, so ambulances, scooters, because these are needed to move samples around, ambulances both to move dead bodies as well as to move patients. So these are things, there's an airlift currently we're discussing with the US government to move those into the 3 affected countries, including drugs and food. South Africa for a long time has been paying to the Cuban government for Cuban doctors in West Africa. And that's been quite an interesting program to date, where the Cuban doctors, as colleagues from the Cuban mission here in the United States has talked about the work that they've done. And then, of course, we have currently volunteer health professionals under the MSF banner, and of course, critically, the UNDP support, which has been under the GEF. There's a special fund that retooled these autoclaves, and I'm going to point that out in a minute, about this very necessary technical device that's helping with sterilizing, as well as could help us with actually decontaminating a whole range of facilities and units using these autoclaves. So this is the laboratory. So those are the packaging goods that were prepared in South Africa in boxes, and then being transported to Sierra Leone, and ultimately getting on the ferry boat. You have to, the landing strip in Freetown is on a small island outside of Freetown, so you take a ferry boat onto the mainland. And then, of course, you can see the first signs of Ebola, that they'd already moved the Sierra Leone's government, and then unpacking at Kappa Hospital in terms of setting up the lab. And ultimately, we were also visited by the President, His Excellency of Sierra Leone, in terms of putting up. So this is the diagnostic lab that's fully functional. We're now expanding the capacity to look at other activities, and there might be support for a second lab in Liberia, depending on links with other colleagues in terms of putting these things together. Okay. Could I get the next slide, please? Okay, so this is the autoclave, the steam sterilizing unit. The technology is developed, I mean, these things are routine in all countries worldwide. The only difference is that this autoclave works in low resource settings. It actually has few moving parts, no computer-driven processes, can work off electricity, diesel generating, or gas generating processes in terms of boiling the water. So the very interesting part about the unit is that these are the drums that are moved around the hospital or the health facility that collects the medical waste. And this is the container unit that is the autoclave itself. So you move the drum around, and then, okay, let's just go back. Okay, and this is the cycle of the drum. So the first 2 of these are already being shipped and are currently in Ghana at the UN MIR. The United Nations has set up a big base, what we're calling humanitarian corridors, in Senegal, in Dakar, and in Accra. So 2 of these units are currently in Accra, awaiting then movement into the one of the affected countries. UNDP has placed an order for 25 autoclaves, so 23 more are in the process of being manufactured and would be then utilized. So it's very simple technology, and can be used and would be a major weapon in terms of working against, in terms of decontamination and sterilizing waste. And ultimately, the sterilizing waste can then be buried or shredded and will be of no this thing. But the key area was its ability to work in low-cost settings with minimal training of technicians and technical support and very little moving parts and ability to be used. So we appreciate UNDP's support that actually helped to pull the autoclaves together, and South Africa now having to manufacture and support this process. Okay, so the lessons, firstly, it takes time. Notwithstanding the emergency, it took us time to get our act together. I mean, at a very early stage, and, you know, of course, there will be reviews after this about how we do things differently, you know, without the loss of lives and input. Communication supply lines was very, very problematic in terms of working through diplomatic issues, notwithstanding we're on the continent. And language is another issue. 2 of the countries speak English, 1 country speaks French. So actually working through issues around language are also quite difficult. Diplomatic links, we had to move through the corridors, moving our staff from South Africa. We had to move through diplomatic corridors through Senegal and Ghana. In the initial stages, it took us 4 days to ultimately get to Freetown through via Egypt, Morocco, and then coming in until we could open up through UNAS. UNMIR and UNAS opened up flights, and then we could get in overnight from South Africa into the countries. You definitely need implementing agents because governments take a long time in terms of bureaucracy, so you need agents. And in our case, University of Witwatersrand was used to collect donations and goods and inputs. We had to deal with other departments in South Africa, like foreign affairs and transport, because the ambulances needed clearance certificates. The tax authorities had to be involved. So these are a lot of organizing to actually pull these things together. In-country recipients, you just couldn't land the ambulances back in Freetown or in Liberia. So you needed in-country recipients. Fortunately, we're working quite closely with the WHO office and UNICEF, and that's being organized, and also the ambassadors in. And then, of course, in the multilateral country governments, Cuba, UK, USA, so we've been working in terms of the model because the UK is helping to support Sierra Leone in a big way, notwithstanding Russia, China, Germany and other this thing, but there's a coordinating structures being set up, the USA with Liberia and France with Guinea. Of course, partly post-colonial, but that's for another day in terms of the inputs coming in and the various UN agencies to ensure success and the World Bank. Governance and management is very important. When you're dealing with public funds, people want to know what are they contributing to. So internal to South Africa, we had to have very, very good governance structures because the problems with corruption always really, as it said, that especially cash money could go the wrong way. And of course, after the acute response, in parallel, what do you do about the psychological and other consequences of the outbreak, and how do we deal with that? Colleagues from China talked about capability, preparedness, and response capacity, including Cuba and Nigeria. So everybody's going to get involved in training. I hope we can coordinate the training. Otherwise, we could have multiple agencies dealing with different aspects. And ultimately, a fundamental issue, resources for neglected tropical diseases. We should not wait for another Ebola outbreak, another Marburg outbreak, before we talk about vaccines, before we talk about drugs, before we talk about delivery systems. So let's start working now using Ebola to actually develop those vaccines and drug supply chains much more quicker in terms of neglected tropical disease that affects many millions of people on the continent and in other low-income countries. And of course, how do we rebuild families, communities, and societies? So I thank you for listening, and this is what we've raised, and definitely we can kick back Ebola. Thank you very much.
Thank you, Dr. Kisnasamy. Indeed, sharing knowledge and technology is at the core of what South-South cooperation is. UNDP is grateful for having had the opportunity to broker and to facilitate this exchange. Our next champion is from Uganda, a country that has had 5 Ebola epidemics since 2000, reason for which national capacities, knowledge, experience have been gained and then shared with countries in West Africa. 20 health workers were deployed, clinical management and training provided. Dr. Alfred Nam is the Deputy Chief of Mission at the Embassy of Uganda in Washington, D.C., and previously head of the European Affairs in the government of Uganda. Dr. Nam, the floor is yours.
Madam Moderator, good morning. All protocol observed. It's a great pleasure to join you this morning to discuss poverty within the context of Ebola epidemics. This morning, I will address Uganda's experience in handling infectious diseases, including Ebola. As you have already been told, Uganda is a country that has had quite a challenge in handling infectious diseases. We still suffer from many of these diseases, including the 6 killer diseases like polio, tuberculosis, diphtheria, whooping cough, measles, tetanus, but the leading killer in Uganda still remains malaria. Besides this, we have had several attacks of infectious diseases such as HIV/AIDS. We also had attacks of Ebola, and we have just 2 weeks ago been attacked, and we have dealt with Marburg virus. So this is to indicate that Uganda is in the front line of these attacks and therefore need to remain permanently alert. In these struggles to keep our population safe, Uganda has to a large extent been successful in containing and killing these diseases, especially you have been told HIV/AIDS was a big disaster for the continent. Uganda was one of the first frontline countries to deal with HIV/AIDS. Ebola followed. Marburg is now on the scene. But I'm happy to report that each time we have had these attacks, we have been bold enough to take measures to control these attacks, and we are grateful to our regional partners and also international partners for all the help that you have given us to affront this challenge. Certainly, the fight against these monster diseases cannot be won in isolation. Therefore, you need to develop local content, you need regional collaboration, you need regional initiatives, and also you need international collaboration and cooperation. I want to share with you this morning the steps we took each time we were attacked by these viruses. 4 steps. The first one is normally prevention. The second one is detection. The third one is response. And the fourth one is treatment. Prevention requires being permanently alert and promptly reporting all strange diseases and symptoms, because we believe in Uganda that no disease is too small. Prevention is improved through sensitization and permanent education of our populations. The message to the populations must be very clear, continuous, and unequivocal in order to bombard the conscience of the population, sink in the message, and become part of daily living. This is the strategy for prevention. You must be able to identify the problem and accept it as a reality. Detection is important, and immediate measures must be taken and put in action to determine the state of affairs in order to avoid creating uncertainty and panic because of information void. My brother from Nigeria talked at length about how lack of information can be disastrous and can cause people to adopt measures which are completely counteractive. We should be able to take responsibility and assume leadership, rapid response. There's what I call the sounding of drums of war. Because when these diseases attack, we should be able to alert everybody about its presence. And this should be immediately and adequately followed by responses by all apparatus of government. We should put into activity health emergency plans. We should have ministries responsible for disaster preparedness, because these have helped Uganda a lot. Because when the viruses attack, they don't announce. You just wake up to find it is already there. And there is need for us to mobilize the stakeholders through engagement and, where necessary, involvement. In the case of HIV/AIDS, we used a lot of involvement of the population because, again, HIV has a different characteristic. It is not contagious by, touching one another. But Ebola, you can only engage the population because there is danger that in trying to come and help, they can also get infected, and this can become a problem. So prevention, detection, response, and treatment have been very critical, and the measures we have taken, that has helped a lot. There is that aspect which we need to talk about, that is awareness creation. Because we think that awareness creation, and our case has proved it, is the first step towards winning the campaign. This awareness creation can be done at different levels. The awareness campaign in Uganda was spearheaded by the political leadership. Because the political leadership has a special responsibility. Political leadership is listened to by the population on the first shot. And we have also cultural leaders, we have civic leaders. We use all these avenues to reach the populations. We have NGOs which play a critical role because they are at the grassroots level. Then we have the health units and practitioners, doctors, nurses, hospitals, labs, clinics, volunteers. All these are avenues for spreading awareness. Then we have population mobilization and the creation of awareness. This helps because if you don't create awareness, there can crop in lies and living in denial. Living in denial is very, very serious. We, at one time, had, when this epidemic in West Africa broke out, there were people saying that, no, there is no Ebola. And when we heard that people escaped from the health clinics, we got so worried. And indeed, we think that part of the problem was because of living in denial, and yet the disease was there. Then we use, in Uganda, we use a lot of media. We use the radios, we use the television, we use the newspapers, we use TV vans, we use mobile phone alerts. Because of the modern technology now, the Ministry of Health has a special role to play. You send mobile phone messages, and everybody in the cities as in the villages have got mobile phones, and they get instant messages. So this creates immediate awareness. So it has helped a lot in us containing. Then, of course, comes the element of treatment. Treatment is an important segment because when people mix up in situations like Ebola, the contagious nature of the disease creates a problem. You need proper quarantines, you need adequate medical services, you need, in case of death, proper and well-arranged burial. In Africa, we have got love. Even the dead, we love the dead people. But in case of Ebola, you cannot approach or come near a dead person, even if it's your brother or sister or wife or whatever, because of the nature of the sickness. And then in Uganda, we worked hard to avoid stigmatization and discrimination. Because when the world was talking about Ebola, and we are still talking about it today, somehow anybody coming from Africa is associated with having Ebola. No, Africa is such a big continent. I think there are 4 to 5 times United States of America in Africa. Doctor from South Africa said cancellations because of tourism in South Africa were made because of ill information. So stigmatization needs to be handled carefully. Otherwise, you affront the wrong enemy. The enemy you are tackling is not the person who is sick. The enemy you are tackling is Ebola virus or HIV. Of course, when somebody is sick, he or she is capable of transmitting the disease, so you need to take care. But the bigger enemy is that virus. So if you mix up the two, then you end up confusing as to who you are supposed to be tackling, which enemy you are supposed to be fighting. Uganda is very grateful for the regional and international cooperation and initiatives that help. As I said at the beginning, in this fight, you cannot fight it alone. You cannot fight it in isolation. You need partners within the country. You need to build local content, leadership, awareness, and treatment. But also regionally, you need to be helped with the monitoring and consultation with the neighboring countries, because epidemics do not know about our geographical borders. So you could be treating one case in a country, and yet in the neighboring country, there is a propagation. So this regional approach also helps. And then, of course, international assistance. We have got a lot of assistance from the United Nations, agencies, the governments, United States, UK, European Union, Japan, South Africa, China, quite a multiplicity. So we are very, very grateful for all this because it has helped us to overcome. In the particular case of Ebola attacks in West Africa, of course, our dear condolence, first of all, to the people and governments of Liberia, Sierra Leone, and Guinea. We are so sympathetic of what you are going through. But Uganda, when we heard that there was an attack by Ebola, we immediately swung into action. In fact, one of the first doctors, we dispatched a team of doctors, medical doctors, who had handled Ebola before, who had some experience, because this was a new dimension in West Africa, and certainly international cooperation was going to take time to come. So we dispatched medical teams. In fact, one of the victims of Ebola, one of the first doctors to die in Liberia, was a very well-known Ugandan doctor, Dr. Mutoro. He went to Liberia to help set up clinical management and coordinating units. We also sent nurses and other people. But at the regional level also, Uganda, together with the East African community, we got together and hastily put together a team of doctors and nurses and sent in a team, I think about 1,000 workers. Doctors, medical practitioners, nurses are helping in the West African region. I'll not be long before I finish. Certainly, Madam Moderator, we have had challenges. The challenges in handling Ebola are many. One of them is lack of physical transport infrastructure to evacuate the sick from remote areas to treatment centers. Second challenge comes lack of medical equipment and facilities to handle crisis, especially adapted hospitals and clinics. The third challenge comes in with inadequate medical personnel trained to handle this kind of crisis. The fourth challenge is poor methods of communication with affected people, making it difficult to report cases in time. Other challenges include high level of poverty that compounds difficulties in handling Ebola. The other one is complete lack of social protection networks and programs. In Africa, we don't have, in Uganda in particular, we don't have very competent insurance systems. So most of the people in the rural areas do not have health insurance. So when an attack occurs, it may start as a small disease, but immediately it spreads to the neighborhoods. And then, of course, we have this late and lackluster response to appeals and delayed mobilization by the international community. This makes available assistance difficult to reach in time. So if we are to address Ebola and other infectious diseases, we need really to work on these challenges. If we believe that health is wealth, which has been said many times, we should be able to invest in health infrastructure, in equipment, develop capacity, train, mobilize the populations, and empower governments to handle epidemics. We cannot afford at all times to use fire brigade approach. because the fire brigade comes in when the fire has already broken. We should be able to handle epidemics in time, and it is my prayer that we can use these methods that we have, or experience we have gained in Uganda, to multiply it so that wherever epidemic will strike, we can use it, and then with the help of the regional partners and international community, we can handle epidemics better. Thank you for your attention.
Thank you very much, Dr. Nam, and sorry again for the interruption. You have outlined the full agenda for South-South cooperation and also for the UNDP program in the region. I would like to introduce our champion from Russia, Mr. Andrei Nastasin, who is now counselor at the Russian Federation Embassy in the United States, and who has worked for over 10 years in Africa. Russia has contributed to the response by transferring to the funds used in the response $17 million, by also providing medical supply, mobile laboratories, funding research for prevention and treatment, and also supporting UN agencies in the region. Mr. Nastasin, the floor is yours, along with our thanks.
Thank you very much, and I would like to express my gratitude to the UNDP organizers for convening this important meeting and such a brilliant panel and panelists. The Russian Federation supports international community efforts to respond to the Ebola outbreak crisis in the sphere of public health in Western Africa. We welcome all related initiatives undertaken by the UN General Secretary, and our country is among co-authors of the UN Security Council resolution on the issue, also supported the UN General Assembly resolution on measures to react to the Ebola outbreak, including establishing the UN mission for Ebola emergency response. The Russian Federation takes all the necessary steps to contain the spread of the outbreak on both bilateral and multilateral basis. In terms of contribution to the international efforts in struggling with Ebola outbreak, our country allocated or plans to allocate the overall amount of 780 million rubles, equivalent to $20 million. In accordance with the government's decision for preventive and diagnostic measures, a special anti-epidemic team of Russian Federal Service on Surveillance for Consumer Rights, Protection and Human Well-being was sent in August to the Republic of Guinea, equipped with mobile laboratory. This group included 9 specialists, epidemiologists, virologists, and laboratory employees. They have been cooperating with the government and Ministry of Health and Public Hygiene of the Republic of Guinea, World Health Organization mission, and Doctors Without Borders. If necessary, the Russian government doesn't exclude the possibility to consider the mobile laboratory work extension in the Republic of Guinea or other countries under the World Health Organization coordinating role. Taking into account the acute shortage of means of personal protection for those medical staff and volunteers dealing with Ebola, Russian Federal Service on Surveillance for Consumer Rights is prepared to send the appropriate medical products to the Republic in Guinea in future, if it will be required. Considerable contribution is made into Ebola scientific research. On the basis of the National Scientific Center, investigative research has been carried out to develop preventive medication and cure for disease caused by Ebola. High sensitivity test systems for disease diagnostics are developed in Russia. Under the project financed by Russia within the World Health Organization, medical modules, including medications and disposable materials, were delivered to the Republic of Guinea and Sierra Leone. Currently, the modality of rendering similar assistance to Benin is being coordinated with the WHO. Russian Ministry of Emergency Situations is ready to take part in international coalition of Ebola outbreak struggle by providing humanitarian aid delivery, special equipment, medications, and food from Russian Federal Agency for State Reserves and ministerial aviation to the affected countries. Russia is able to provide air transportation of international forces and help to evacuate to and from affected zones, as well as the evacuation of the infected people and medical personnel. A possibility of rendering financial, material, and technical assistance to the Ebola-affected countries within World Health Organization, World Food Program, and UNICEF is under consideration by the Russian government. In October, the Russian private air charter company Nizhnevartovsk Avia sent to Sierra Leone 5 civil helicopters Mi-8 to assist the specialized UN mission. And in 2014-2015, the government of Russia pledged to allocate $2.5 million to the special fund established by WHO to support the application of international medical protocol. So this is the brief introduction of what Russia's contribution is to the Ebola outbreak in Western Africa. Thank you very much.
Mr. Nastasin, thank you very much. Please join me in thanking all panelists for great presentations today, for a great show of commitment, and for the support provided to West Africa, and for their partnership granted to UNDP. This is not the end of our cooperation. We are here to celebrate its start, and we do hope that the response will be scaled up to ensure that post-crisis those countries restore growth, those countries return to development, those countries will be able to offset rapidly the destructive impact that the disease has had. We thank you all very much, and I'm very pleased to announce that our panel will be followed by a ceremony, a short ceremony of gratitude and thanks to representatives of the Gambia, Cuba, Nigeria, as well as China, South Africa, Uganda, and Russia for their contribution to the UNDP response to West Africa crisis. Thank you.
So distinguished panelists, thank you very much for attending this event organized by UNDP. Well, UNDP feels very privileged to have you all, ladies and gentlemen, participate in this event. UN Office for South-South Cooperation, as the organizer of the overall Global South-South Expo, would like to give awards to the panelists and the organizers for special contribution to South-South cooperation and triangular cooperation. The awards will be delivered by President of the High-Level Committee on South-South Cooperation, His Excellency Ambassador Abkalam Abdul Momen, and Envoy of the UN Secretary General and Director of UN Office for South-South Cooperation, Mr. Yiping Zhou. So the first award will be delivered to Mrs. Ruby Sandu Rojan, Deputy Assistant Administrator and Deputy Regional Director of the Regional Bureau of Africa, UNDP, for organizing this event. Ruby, please. Yes. Yes. The award will also be given to Ms. Simona Marinescu, Director of Development Impact Group, Bureau for Policy and Program Support, UNDP, as our moderator for the event. For sharing the knowledge and visionary insights, we would like to award His Excellency Mr. Omar Say, Minister of Health and Social Welfare, Gambia. Special thanks for the strong support of His Excellency Mr. Jose Ramon Cabanillas Rodriguez, Chief of Mission of the Cuban Interest Section in the United States.
Thank you.
For strong support of His Excellency Dr. Cyprian Tercia Hin, Minister Counselor, Permanent Mission of Nigeria to the United Nations. For strong support and solidarity from China, represented by His Excellency Mr. Yao Shenhong, Director General, China International Center for Economic and Technical Exchanges, CSET, Ministry of Commerce, China. And also, together with Mr. Yao, we have a representative representing a special public-private sector partnership, Mr. Li Ye, Fujian Xianzhilou Biological Science and Technology Center, for their taking initiatives for future contribution to Ebola and other broader South-South cooperation agenda. For His Excellency Dr. Barry Kistanasmi, Ebola Response Coordinator, Department of Health Disease, South African National Department of Health.
Thank you.
For His Excellency Mr. Alfred Nam, Deputy Chief of Mission, Uganda, Embassy to the United States in Washington.
Thank you. Thank you.
And very importantly, His Excellency Mr. Andrei Nastasin, Counselor, Russian Federation Embassy to the United States of America.
Thank you, Roshan.
Again, a big applause to all the participants, yourself, and the panelists. Thank you very much.
With this, our session ends. Thank you.